I'm Rabbi Stacy Schlein. I'm the Director of Educational Capacity Building at the Jewish Education Center of Cleveland. I work with our synagogue education programs and our early childhood programs. We're honored to have so many of you with us here this evening for our webinar. We especially want to thank the Jewish Federation of Cleveland for providing all of us this incredible opportunity to be together. Webinars like this one have really been invaluable. I know I can't even count how many webinars I've been in at this point, but it's really helped me to make my way and to make all of our ways through the pandemic. I also want to express my gratitude and also to recognize the Jewish Federation of Cleveland's board chair, David Heller, and Erica Rudin-Luria, president of the Jewish Federation of Cleveland, for their leadership. Together, they have helped us to navigate these uncharted waters with tremendous skill and compassion. So thank you. One of the core strengths of our Cleveland Jewish community is its commitment to caring and providing for others. During the past few months, your Jewish community, federation, agencies, schools, synagogues, all of our community partners have demonstrated incredible strength and resilience as we have worked together to face the impact of COVID-19 and Jewish Cleveland. And it is because of the strength of our Jewish community and thousands of generous donors that the Jewish Federation has been able to respond to so many of the ongoing needs in our Cleveland community. Through the annual campaign for Jewish Need, the Federation enables our community to achieve what no one organization or one person could do alone. Generous support empowers all of us to be here for good. As together we can care for one another, prepare for the future, share our perspectives, and repair our world. To learn more about the 2022 Campaign for Jewish Needs and how you can be here for good, please visit the campaignforjewishneeds.org website. It's safe to say that during COVID-19, we are living and raising our children in one of the most uncertain times in modern history. When planning for this webinar, our goal really is to help you, to help parents to navigate this next phase of the pandemic as we begin another new school year. So we wanted to provide this platform to hear from some of the best, I would say, and really to dig into some of the practical details that are going to help all of us navigate this next phase. Tonight, we have the privilege of speaking with two, as I mentioned, best of the best in our community. And before I introduce them, I do want to mention there will be opportunities to share questions. Please, please, please do not be shy. We're going to try our best to get to as many of the questions as possible. We invite you to submit the questions into the question and answer box. And we ask that you try to address the panelists specifically with your question. And if you can include the age or ages of your child or children, that would be really helpful. First, I'd like to introduce Dr. Arthur Lavin, who is a pediatrician in private practice, an associate clinical professor of pediatrics at Case Medical School in Cleveland, Ohio, and the chairperson of the American Academy of Pediatrics Committee on Psychosocial Aspects of Child and Family Health. I'd also like to introduce you to Dr. Suzanne Schneps, PhD. She is a clinical psychologist who has been in practice for over 30 years. Prior to her clinical experience, she trained as an elementary school teacher and every single special education thing you could imagine under the sun. Dr. Schneps received her PhD from Case Western Reserve University, and she has a thriving private practice to help many in our community. We'd like to say thank you to both of you for helping us and making time to be with us tonight. So now we're going to just dive right in. I'd like to start by asking a series of questions to our presenters based on what they've heard from individuals in our communities. So the first question is for Dr. Schneps. Dr. Schneps, can you update us on where we are with how children and adults are handling the current situation, with a special focus on mental health, of course?
Okay, I think there's tremendous variability on how people are handling this situation. And I think the message that I think is important that we think about is our kids reflect our anxiety. So the calmer that we can be in the midst of all this confusion, the better our children are going to be able to handle the situation. There are obviously those kids, Stacy, who have their own unique levels of anxiety and bring that to the foreground. Most kids reflect how they perceive their parents to be putting forth their own concerns about all of this. And, I think what becomes important to minimize that is it's not their job to know the information. One of the things they can tell people is they're going to not listen to me, but they're going to listen to Dr. Lavin, and they need to know, the kids, that their parents are keeping them safe and their parents are getting the information from reliable sources. And it's their parents' job to sort out the information and their parents' job to take care of knowing that.
Thank you. That's a really helpful overarching frame for us to start off the conversation. And Dr. Lavin, I'm curious to hear your perspective medically about where we are regarding COVID, how that impacts children, current research, and where your head is in this right now.
Sure. Thanks, Rabbi. And thanks to the Federation and really to the entire Jewish community and everyone who's joined us this evening. So I know everyone on this call knows we're in the midst of a historic catastrophe, and everyone's in a hurry for it to end, but we're not in charge of it ending. The virus is in charge. And I think that's very frustrating for everybody. It's certainly frustrating for me. And I know all the families I take care of have really had it with this pandemic as well. So, in May and June, we were looking at, before Delta arrived, if Delta had not appeared out of India, we might be looking at, in some ways, the end of the pandemic, because the old COVID virus, the initial version of the SARS-CoV-2 virus, which caused COVID-19, seemed to be suppressed when populations got close to 50% immunized. We saw it in Israel. Israel is one of the first large countries to reach that goal, and transmission stopped. And it stopped for the most part here, which is why we all got that breather, that sense that, oh my gosh, maybe this thing is over. And then Delta hit, and Delta brought with it three differences. I think it's helpful to keep in mind. People talk about how confusing this all is, but I like to say that in some ways, it shouldn't be that confusing. It's a virus. The virus changes a bit. We only have one variant right now that we're dealing with. And so some of the elements are fairly clear. And one thing that's very clear is that we're dealing with the Delta variant. Essentially, all the cases of COVID that we're dealing with are from that particular germ. And there's three things that distinguish the Delta variant and define our current reality. The first is the Delta virus is far more contagious, which means it spreads far more easily, which means it takes a lot less contact, takes a lot fewer viruses in order to catch it. That's bad news. That's why we had about 55% of the United States immunized, and this thing's still flaring, because the old virus, as we said, stopped when we were at 50% immunized. Not this one. That's because it's more contagious. Mm-hmm. The second major disappointment is that for the first time, we've got a type of COVID virus that if you're immunized, you still can catch. And when Delta first appeared, I consider that the $1 million question. Would immunized people catch it, and would they spread it? So the second difference is that the Delta variant can infect immunized people, and immunized people have COVID from Delta, can spread it. That's very bad news, because the good news, I should say, for the immunized folks is that yes, you can get COVID, the Delta COVID, if you're immunized, and you can spread it, but you're almost certainly not going to be hospitalized or die from it. So the wall of catching it has been breached, but the wall of getting very sick and dying hasn't been substantially breached. What that means is a lot of the people who are immunized who have COVID don't know they have it. And if they spread it to someone who's not immunized, the virus may not be very strong in them, but it's going to be just as strong in their children or in another adult who's not immunized. And that brings us to the third major disappointment from Delta, and that is the old COVID virus. We didn't know this last year when school started. Remember, we were all holding our breath to see whether COVID would rip through the schools.
Right.
It turns out it didn't. We didn't have many outbreaks in schools because the old COVID virus didn't get inside kids' cells very well and didn't spread from kids very well. Here's the third and final tragedy of the Delta variant. The Delta variant has found a way to infect children and allow children to spread it to other children. And so that's the news on Delta. And just to finish the answer to your question, Rabbi, we're seeing as a result of that, of those three facts, that's far more contagious, immunized people can spread it, and that children can get sick from it. We're seeing a huge jump in number of kids with COVID. We're seeing outbreaks in schools already this year in our region that we just didn't see last year. And the schools have only been open for some people, for most people, less than a month.
Right.
So we're very, I think that is now the $1 million question. What's going to be the fate of our children? Everyone under 12 is unimmunized, and they're facing a very dangerous virus.
So since you just brought up the piece about immunization and this, I mean, this is the question we all want to know, and we keep asking doctors because we're hoping for different answers. And it depends on how people are interpreting the data, but I'm curious, when you're seeing the information coming out about testing for the vaccines, how do you understand the data? What are you seeing on the horizon?
So last few months, the message from Pfizer has been very clear. They're planning on reporting results of their studies this month. They've been saying September for several months. Now it's September, so we're all anticipating. Dr. Fauci said as much 2 days ago that he's expecting, not just me, he's expecting the results in hand this month. Now, people should understand that Pfizer's the manufacturer, and we all want our government, we want somebody to come to the manufacturer and say, are you sure this is safe and effective? Do the data really prove that it's okay to use in kids? And so it's the FDA's job to come to the manufacturer and challenge them. Now, normally that could take many months or a year. That's the approval process. But we're in an emergency situation. We're not going to take any shortcuts. But I can't give this vaccine routinely to children age 5 to 11 until the FDA and the CDC tell me that it's met their standards for being safe and effective. Now, Rabbi, and the community, I have to share with you, this is not such a new vaccine anymore. We've given it to we've issued 4.5 billion doses. So we know what this vaccine does. I would be quite shocked if they found that this vaccine was any different in 5 to 11-year-olds than in 12 to 100-year-olds. Keep in mind, we give vaccines across the whole age range from measles and chickenpox and tetanus. We don't see any differences in 5 to 11-year-olds and older people. So I don't anticipate any difference here. And because we've had such experience with this vaccine, and we don't anticipate much difference, if the evidence shows that it's safe and effective, the country is anticipating, frankly, expecting the FDA and CDC will act quickly. If they do, we could be opening the door for 5 to 11-year-olds getting immunized against COVID in October.
Okay, thank you. And I think like that piece of knowing that it's been so successful, there is that data, and still we want to go through that process to ensure that is going to be safe for the children, gives an extra measure of relief, hopefully some comfort, and then we kind of just have to wait. And that piece about waiting, I think there was a question that was submitted that was quite colorful in language from parents, struggling with like, when is this thing going to be over? And we can't answer that. I don't think any of us
mean
can.
the pandemic being over?
Yes.
So I do want to say something that's all right. I want everyone to know it will be over. So there's been a lot of pandemics. As far as I know, this is the only really deadly pandemic in human history we've had a vaccine for. So all the other major pandemics, the last one being the 1918 Spanish flu pandemic, they've all ended. They all stop. They tend to go about 2 or 3 years. We're going to be hitting 1 year soon, right? Am I counting right? Actually, so we're past the year mark, and we're going to be hitting 2 years at some point. So viruses in our bodies tend to make truces. This will not go on forever. I think it's just very painful right now because it looked like it was over in May and June. And here we are, in some ways, worse off than we were last year. And now I say worse off in terms of kids, 12 and under, we're definitely worse off than last year. But in terms of the close to 200 million people have gotten at least one dose of vaccine, we're way better off than we were last year.
I think with kids, the thought of when is it going to be over, since we're all going, whatever colorful language you got there in the response. And of course, so first of all, I think that comment that it's important to be able to say to our kids, we know it'll be over. The thing is that they have no time frame. Of course, I'm beginning to wonder if I have a time frame and you all think have time frames, so,
Right.
if it could be over in 3 years, that's forever. So I think the other piece of it, though, is to say, we got to break this down. We cannot, and that's so different than how we've, always planned. So it's to help the kids to focus on, let's look at what we're going to do this week. We kind of know the plan for this week. Do we really know the plan for the month? I'm thinking probably not, but we could probably make a fairly good educated guess of what it is for the week. And I think that is helpful to kids in dealing with this never-ending pandemic.
Right. And I one of the last webinars that Federation had hosted with synagogue leaders about what's going to be happening, the team from UH said, really, let's talk about the next 2 months. Let's focus on that. And that resonates with what you're saying, Dr. Schneps, really breaking it down different pieces at a time so that it's not quite as overwhelming.
The other thing I want to add, Dr. Schneps inspired me to think that, messages like in 1628, we could say it's going to last 2 or 3 years. In 2021, if I was a 10-year-old, I'd be asking the adults, why didn't you stop this already? We've had the vaccine since last November, and we have it in our hands. We know that if 100% of the population got immunized, the burden on the kids would be lifted. So we could stop it and stop it real soon. We have that power.
Right. So what, and I think now we have a taste of what you were like as a child, right? So, I mean, how do you respond when a question like that is asked?
I think that's a really good question. And of course, I think that it is one that many of us have the way that we want to respond. And then there's people that are over here. Okay, so first of all, I think, the Ohio State, Michigan, the house is divided. The ones that put up signs, it's like, I guess we have, the house is divided on this. I think that it is reasonable, if you are a believer in the vaccine, to say, you're right. It could have been different, but it's not. You can represent the truth. And they hear it anyway from you all the time because you're all busy, talking between yourselves. So you need to say it honestly to them. If you're somebody who's on the other side, I guess you need to say, well, we see it differently. And I think that's a different story. But I think it is reasonable to represent the truth and how you see it and what you believe. Dr. Lavin, do you concur with that kind of approach?
Yeah, sure. I mean, we're talking about how parents with different views speak to their children. And I think that's an important point. In each household, it's a very intimate thing to have a parent talk to their child. And we're not here to say there's only one way to talk to your child, for sure. One thing that's interesting is, as I said, Israel demonstrated that in the old COVID virus days, if you hit 55% of the country immunized, transmission ceased. Even the unimmunized didn't get COVID anymore. There's going to be a number like that for Delta. We don't know what it is yet. But if the United States achieves that number, we could see COVID transmission rates drop to nearly zero, and again get back to that beautiful period we had back in May, June, early July, when everyone felt as though the risk was over. So I don't think it's going to be 100%. I think it's somewhere between our current level of about 55% and somewhere hopefully well below 100%. But I just want to hold out hope for people, no matter what their feeling about the vaccine is. The country could enter a phase where the virus goes back into retreat.
So there were a series of questions that people had asked about, there's this weighing of different safety issues and trying to figure out how you navigate it. So there were some very specific questions about indoor children's activities, like going to rock climbing gym, volleyball, indoor soccer, going outdoors, being with larger groups of people. There might be a mix in terms of people being vaccinated, wearing masks or not. And then what happens when you go to something that's a indoor space, like going to the grocery store and things like that. So I'm curious, Dr. Lavin, about the medical advice that you would share about navigating and weighing those things. And then Dr. Schneps, if you can share from the psychological side.
Well, I think that question is complicated by the psychological dimensions we live in.
Right.
If you remember last year, there was no question about doing any of those things when COVID really hit the scene. Last St. Patrick's Day, we locked down. No one went anywhere, and that was a virus that wasn't nearly as contagious, and turns out not to pose much of a threat to children. So now we have this curious situation. Fast forward a year and a half later, and my goodness, here's a virus that is far more contagious to children. And we're all feeling enormous pressure not to go into that cautious space, to continue going to rock climbing and birthday parties and grocery stores and friends get together and sleepovers. And in school, without the virtual, most schools don't offer virtual options right now, which is very curious, given that we have a virus that's probably presenting more of a threat of outbreaks than last year's school year. So on the one hand, you've got the personality of the virus, and now on the other hand, you've got the social personality of our culture, which is demanding that we stay as normal as possible. So now, I guess you could simplify the question by saying, Dr. Lavin, what would you do with your 8-year-old child if you were in this situation today? Mm-hmm. And the way I think about it is, I think the only way I can get my way through this answer is to have a hope that Delta will be in the United States like it was in India and England and the Netherlands and Spain and Iceland and most of the world. Delta burns hot and it burns fast. And we're seeing that this one cause all sorts of tumult, but in most countries, it's a 2 or 3 month event. And so what we're talking about is being careful with this very hot virus for 2 or 3 months, not for another 2 or 3 years. Now, I don't know that it's going to go away in 2 or 3 months. I'm really hoping that in 2 or 3 months, enough people get vaccinated, we could put this thing away like we did the last COVID virus. Yeah. But let's just say that we can reasonably expect, at least reasonably hope that in 2 or 3 months, the danger will lift. So I guess my advice would be, can we just be careful for 2 or 3 months? And not necessarily shut everything down, but I don't know. You think about it. We look, the colds are everywhere. All of our children have colds, and if colds are flying, you can bet COVID's flying.
Right.
So the COVID virus is out there. It's spreading. If you go indoors, especially if you go indoors unmasked, you're really risking your child getting the Delta variant of COVID right now. But again, that risk is peaking. I think it's peaking around now.
Dr. Schneps, how would you respond to some of those questions?
Well, I think the question that comes, for many kids is, but, Shira's family is allowed to do such and such.
Yeah.
Okay, so remember how we all hated the line, well, I don't really care about Shira's parents. Still don't care about what that doesn't work. And I think what it is important to say is every family has to make their own decisions. And we need to have our kids recognize they might not know what some of the factors are that contribute to certain families making certain decisions, particularly the more cautious ones. They may not know why that is. And it's to explain that in our family, this is what's going to work. And I think they need a simple explanation. Our explanations about this kind of need to follow like how we talk about sex with kids. We're talking a wide range here. We're talking 4-year-olds and 11-year-olds. The difference is huge in terms of how we explain this. The 4-year-olds are very black and white in their thinking. It's very confusing that there could be more than one thought to them. We think it's sometimes confusing too. But we need to give a simple explanation of why we've made the decision and why this is okay and why this is not okay. And to go back to that thought that as parents, each parent wants their children to be safe, and it's their job to keep them safe. But we're going to see lots of differences in who's allowed to do what. And I think that's really hard for the kid, for kids. And, the kids are feeling like, I've had enough of this. Well,
Right.
And it's why it's not that the constant absence of being told, well, you can go do this, but you can't do this with so-and-so because, they've just been exposed to COVID, and we're not going to do that. So it's reiterating to them why and keeping it what's safe in your family. And I think there's lots of differences.
Thank you. And as a parent, there are all these moments where you're having to draw on like these skills based on how you understand medical data, how you have your own values growing up, what you believe philosophically, drawing on what the expert advice is, but you have to hold all those things and make the best decision possible, which as parents anyway is so challenging. And then to do it in the middle of a pandemic makes it that much harder. But on the same token, maybe just to sort of like, okay, but I'm a parent, so I can do this and I'll do the best that I can.
But I think it's also reasonable to say, you know what? I don't know that I know what's the right plan for that. I need to call the doctor. I need to speak with so-and-so. I don't know. It's a good question. I want you to be able to go do blah, 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 but I need more information to understand whether or not that's going to be a good choice.
Yeah, I think it's really helpful.
Have the answer right away.
Right. I think that's really helpful.
One thing I would advise everyone to be very careful with when we talk about all these swirls of pressures back and forth. One thing that should stay very consistent, that's weakened quite a bit actually recently and shouldn't, is the quarantine rule. So, let's say, someone's 6-year-old is diagnosed with COVID, sad to say, and they have 2 siblings, a 3-year-old and a 10-year-old. So some schools are actually asking the 10-year-old to come back to school during the quarantine period. At some schools, I'm told by families are even saying if they don't, it's an unexcused absence. Some families are feeling like, I just can't keep them, it's the first couple weeks in school. They can't miss the first couple weeks in school. So the name of the game here remains trying to keep a very dangerous virus from spreading to other people in the community, other kids in your household and such. And one of the best tools we have for that is if you actually know someone who's got COVID in your family, making sure that other people in the family don't spread it to others in the community. Obviously, the child identified with COVID isn't going to be allowed back in any school today until they've completed their quarantine. But I would really, really urge families to be very careful about following CDC guidelines and not going soft on that, especially right now.
Thank you. We have a question asking, what specific advice do you have for schools until kids are vaccinated? This was from a teacher, by the way.
From a teacher?
Yes.
Well, so again, the name of the game is keeping kids in your classroom getting COVID. And schools are in a tough position because the community at large hasn't stopped the transmission of the virus. As I mentioned, COVID is here. Ohio's rates are climbing. Just to give your audience some way to follow this, I like the number of how many people in Ohio are getting COVID each day out of the total population. And I like the number per 100,000. If that number's under 5, there's not much transmission. When it goes over 10 or 20, I start to feel like the virus is really flying around. Mm-hmm. When Florida was at its worst, a week or two ago, it was at 100 or 120 for that number. Ohio's gone from 20 to 60 in the last few weeks. So it's a bad number. COVID is flying around. And what's a teacher supposed to do when, the state of Ohio is flooded with the virus? So at one level, I just want to be realistic that we're going to see COVID spreading. But in that setting, it's all the more important to do what you can. And so the first thing is to say, why not do everything you can? Why not reduce the chance that students in your class will be less likely to get this potentially significant illness? So here's a couple things. Wear a mask. Second is ventilate the room. I like to advise parents that you go on Amazon for $60, get a CO2 monitor. You want that level to be under 600. You want to keep the kids 6 feet apart. You want to make sure, if you can, not many schools are doing this, but I love the idea of podding classes. So one group stays together and doesn't mix with other groups. And so these are all techniques to try to reduce the flow of the virus. I'm sorry that some of these have become controversial.
Yeah.
Fortunately, stopping at a red light's not controversial. It hasn't become a political issue. These should be no more controversial than stopping at a red light. It saves lives. It's not that big a deal, and could slow the transmission through school. But I do have a soft spot in my heart for my friends who are teachers who are facing this tidal wave and trying to keep the waters back.
I have a question with that for the teachers, Dr. Lavin. Do you think that if they can teach outside sometimes, that's another, that would be really helpful?
Huge. So in the old, we don't have all the data in on Delta, how many feet away and how long you have to be with somebody. All those numbers are from the old virus. But from the old virus, we knew if you're outdoors, your chance of catching it dropped 20-fold. Like, what is that, 2,000%? Or 20,000%. So it makes a huge difference. Good question.
Great, thank you. There's also a question asking if we have local data on how many children ages infant to 11 are currently hospitalized with COVID.
I don't actually have those numbers handy. I do want to say a couple words about this, though. So I want to say a word about risk, because I think it's important to be concerned about it and also not to be overly concerned. So I don't want to minimize, I don't want to maximize, but if something very rare occurs and you double the risk of it happening, it's still a very rare event. And on the news, we hear a lot about the risk of a child ending up in the ICU increasing 5-fold or 10-fold. But most children with COVID do not end up in the ICU. So I think a lot of people following this news, looking at the Florida pediatric ICUs and the Texas ICUs, might dread that if their child gets COVID, they're likely to end up so sick they need intensive care. So on the one hand, I don't want to minimize the threat. There are children ending up in the ICU in Cleveland. And those numbers are much greater than last year. But still the case that most children who get COVID do not get terribly ill. And not to be too, not to touch on too scary a subject, but fortunately, the great majority of children who are in the ICU survive that. So we talk about loss of life, that is still, I mean, across the country, when I checked last week, the total number of children who've died from COVID across the United States has been something in the 400 range, out of over 600,000 deaths. So we talk about death being less likely when you're young, it's vastly less likely. So on the one hand, I don't want people to take my comments and say, oh gosh, COVID's not as bad as we thought for kids. Go ahead, do what you want, don't take any precautions. But I also don't want people feeling as though if their child is diagnosed with COVID, that a terrible outcome is certain. That is not true either.
Okay.
And the other thing I want to say about that is that of the kids I've seen personally in the practice, essentially everyone who's been diagnosed, been a fair number who've been diagnosed, they've all done quite well. Oh, I know the other caveat is, of course, we don't want our kids to get COVID because we don't know. You might be fine when you're 10, 12, or 14 with COVID.
Right.
What was it do for you in the next 50 years? So yes, we still want to be cautious, but it's not necessarily a terrible thing for a lot of children if they do get it.
Stacy, I think what's also important, though, is this is adult information. These are the kinds of parents do not need to share with their kids. So they don't need to know how many deaths there are of kids and how many kids wind up in the hospital, because that's terrifying to them. And they don't have the mathematical perception to narrow this down to how few it is. And they'll worry that it's going to happen to them. So I think this is information that helps us as adults to feel comfortable. It is the opposite with kids. It would make them very anxious.
And she brought up the comment about making children anxious. I know you started in the beginning about generally how children feed off the parents' energy unless they have anxiety. We did have a parent who asked a question. Their child does have an extreme amount of anxiety about COVID and staying safe, especially like being around crowds, being indoor with other people. So what are things that this parent is able to do to help address some of that anxiety?
So first of all, I think the parent wants to say they would never knowingly put their child in any situation that wasn't safe. They certainly wouldn't say, get off in the middle of 271 and run across the street, because it wouldn't be safe. And I think they need to give other kinds of examples that they work to keep them safe. By the same token, I think they need to understand that anxiety is really real for some kids. It's overwhelming. And so think about going to school. You know, when any of us are anxious, it's hard to learn. That best example actually that I always give is you go to the doctor and they tell you that you need some kind of surgery and you have enough brain cells to understand that. And then you go home and try to tell anybody something and you were so anxious you couldn't get the material. So they need to recognize that that's the level of anxiety for some kids when they go to school. And they need to think about what are the situations that, how do I want to say this, that are imperative that their child has to be in. And then I think it's cutting their kids some slack, because it takes a lot of energy for that type of child to go to school. So they don't, to do other things, it's overwhelming. They don't have the energy. And then they're going to need a lot of downtime at home. I also think it helps to just, to say, you have your mask, and it's a great mask that we bought, and why it's a great mask, because that's a positive thing to be able to say to that child. The other part that happens in particularly our Jewish community is when there is a problem with somebody, everybody knows about it. One of my most anxious kids came in to see me, and he told me about an adult that had a breakthrough. And I said, "Did you know him?" And he said, "No." I said, "Was his name such and such?" And he said, "Yes." I said, "I heard about it too, but I don't know him either." He's the icon of what's happening, and it's one person. And by the way, he's fine. He's okay. So I think we need to also recognize that with that anxious kind of kid, I really encourage them not to listen to a lot of newscasts. You'll give them the important information, but they're picking up things that they don't necessarily have the ability to understand, and it increases their level of worry way beyond. And I guess, and recognize they need some downtime.
Yeah. Okay, so we have a lot of more questions. We're not going to get to them, so I'm going to be completely unfair and ask you hyperspeed. So for Dr. Schneps, if you can talk about some signs or things we should be looking for if that's a red flag your child might be experiencing anxiety.
It's a red flag if they're sleeping all the time. It's a red flag if they won't go to school and they're school phobic. I'm really concerned. It's a red flag if they stop eating. Those are the three biggest red flags that you need to get help quickly. The fourth would be that they're talking and telling you they're anxious, and sometimes then it's helpful to have an appointment with somebody, even to talk with the pediatrician just to get some information to calm it down. But those are the biggest flags.
Thank you. That's so helpful. So then there were two medical questions. You have a whole minute to answer. One, what should we do about the flu shot? Should we still go get the flu shot for our children? And two, what do you think about the effectiveness of cloth masks against the Delta variant?
So flu shot, yes. Very important. I won't elaborate on it. It's important during the pandemic and the flu shot. The second one requires a couple more sentences. The Delta virus, as I said, is more contagious, which means you need fewer viruses to sneak into your nose to get COVID, which means if a cloth mask lets in a certain number of viruses, you're more likely to get it than if an N95 lets in far fewer viruses. So the cloth mask was probably not great, but okay for the old COVID, not very good for Delta. I would recommend everyone go to projectn95.org, and you can get, now we get, N95 masks all over the place, but projectn95.org has certified N95 masks. The small ones fit a lot of children. But I would upgrade to the N95s during Delta.
Okay, thank you. That's really helpful. So just want to say a few words in closing. And I'm going to ask Erin if you would be kind enough to open up the chat. I think it would be great for people to share one thing that they're taking away from this webinar this evening. That you're going to carry forward. And while people are typing that into the chat, I want to really encourage you to think about where we are in this time in the Jewish calendar as well. Finishing up, celebrating in the joy and the excitement of the new year, tempered a little by what's been going on. But also as we head into Yom Kippur, we think about how we can go through the process of teshuvah and turning and changing our behaviors. There's a lot of discussion and focus on asking for forgiveness from other people, We know that if we've done those things, that we can be forgiven by God. And one of the things I think we forget is to really be able to forgive ourselves and to recognize everything that we are carrying and holding, how difficult it is, and really to honor that we're doing the very best that we can. So I hope you take that with you as you head into Yom Kippur. I want to thank everyone. A big thank you to Dr. Schneps, Dr. Lavin. Huge thank you to the Jewish Federation of Cleveland for always being there for all of us and supporting us, creating these really incredible opportunities to support one another. Thank you for joining us and wishing everyone all the best.